Good evening, everyone, and welcome. Thank you all so much for joining tonight's webinar session, Beyond the Bullet Part 2. We're going to give it a couple minutes before we get started with today's program. Thank you all again so much for joining. Hello, hello, and good evening again, everyone. For those of you who are just joining, welcome to our Part 2 series of the Beyond the Bullet webinar, a national town hall on policies and programs to better support communities. We're just going to give it a couple minutes before we get started with today's program. Thank you all again for joining. I see people dropping their names and where they're calling in from. Welcome, welcome to those who just joined. Feel free to just go ahead and start sharing some greetings, dropping your name and the organization you might be joining from. We would love to hear from you. And also, just so you all know, this is a webinar today, so you won't have the ability to come off of mute, but you can interact with us by way of the chat box. So thank you in advance for that. Thanks, everyone. I see more people dropping their names and their organization's name and where they're calling in from. Please continue to use the chat. We would love to hear from you. And thank you again for joining today's Beyond the Bullet Part 2 webinar series. All right, everyone, I think we can go ahead and get started. So hello, and welcome to the Alliance for Safety and Justice and Crime Survivors for Safety and Justice's National Town Hall webinar as a part of our Gun Violence Awareness Month. My name is Christina Plummer, and I'm the Program Manager for Crime Survivors for Safety and Justice. For those of you who will need a Spanish interpreter, please select the interpretation icon on the Zoom keyboard. And this will allow you to have those services available to you so that you can hear what's being shared. So again, for those of you who just joined, we would love to hear from you if by way of using the chat box, if you could share your name and where you're calling in from and maybe the organization that you are affiliated with, we would love to hear from you. Today is a webinar, so you won't be able to interface with us by way of using the microphone, but you can use the chat box. So I'm gonna start out with some shout outs to get us started. I see greetings from Ineko Jefferson, from Love and Courage, from CSSJ Inland Empire, California chapter. I see Miss Carol here from Southern Arizona. Love and blessings from Where Do We Go From Here, Inc. Dr. Janice Little from CSSJ Richmond, Sugar Land, Texas chapter. I see some of our staff here. I see Trisha from Austin, Texas, who says she is glad to be here with us tonight. I see Cheryl from Cleveland, Ohio. We have Katrina from Phoenix, Arizona. Christy Stanford, Phoenix, Arizona. Juanita Harper from Pontiac, Michigan, CSSJ chapter. Miss Doris Strong from CSSJ Tallahassee, Florida chapter. We have Tracy here from Fort Pierce, Florida. So again, continue you all to just share where you're calling in from, your name. It's so good to have you all here with us, and thank you again just for participating in today's event. So with that said, I do want to give a huge shout out to our CSSJ chapters who are hosting live viewing parties like the one that is being held right now in Cincinnati, Ohio. Thank you all. I hope you all are enjoying tonight's program. We're going to kick it off by turning it over to Jonathan, who will walk us through today's agenda for the webinar. Thank you all again for joining.
Thanks, Christina. Good evening, everyone. I'm Jonathan Lewis, the National Training Director for Crime Survivors for Safety and Justice. And I want to just share a few housekeeping notes as well. Once again, as Christina already mentioned, this is a Zoom webinar, so no attendees will be on video. However, we still would love for you to engage with us in the chat box and especially during our question and answer section. And if you're joining us live on the CSSJ Facebook page, we look forward to hearing from you in the comments. And so today you'll see the agenda on the screen that we'll be going along with. But first, let me start off by sharing, for those of you who may be new to our work, just want to share a few things about our organization and some history. So the Alliance for Safety and Justice is a multi-state public safety organization that aims to replace over-incarceration with more effective public safety solutions rooted in crime prevention, community health, rehabilitation, and support for crime victims. We do this by partnering with state leaders and advocates to achieve safety and justice reforms through advocacy, organizing, coalition building, research, and communication. Just to give you a little more around our flagship program, which is Crime Survivors for Safety and Justice, we are a national network of 200,000 crime survivors. We build community, provide real-time support, train leaders, and provide mobilization opportunities to engage in policy change and build political power. And so in my role at Crime Survivors for Safety and Justice, I spend a lot of time traveling the country, listening to stories of survivors and training them to be advocates. And so I had the opportunity just 2 days ago. I was in Pennsylvania with leaders from across the state, and we met with dozens of legislators to share our stories and advocate for a better justice system. Those members advocated to increase access to victim services, expand housing and employment protection for survivors, and continue working to establish 4 additional trauma recovery centers across the state. Today, you'll hear remarks from our vice president, listen to an awesome panel of experts, and followed by some questions and answers from you all. And we will have a few call to actions later on after that, including an opportunity to light a candle to honor someone who has been affected by gun violence. With that being said, now I would love and welcome our ASJ Vice President and National Director for CSSJ, Aswad Thomas, to say a few words.
Thanks, Jonathan. Hello, everyone. Man, I'm so excited to be having this conversation with you all. I see so many survivors and organizations and advocates from across the country who are on the front lines to not only gun violence, but all forms of violence that affect us as individuals, our families, and our communities as well. To those of you who may not know me, I am Aswad Thomas. As Jonathan mentioned, I am the Vice President of the Alliance for Safety and Justice, and also serve as the National Director of Crime Survivors for Safety and Justice. It's really it's both an honor and a privilege to welcome you all to this virtual town hall. This event is just crucial as we come together to really address, one of the urgent issues in our neighborhoods, in our country, and also the urgent need for policies, programs, and also more financial investments that better support survivors, families, and communities that are impacted by gun violence, but also policies and programs and investments in our communities that impact all forms of violence as well. And before we begin our discussion, today, I would like to take a moment to really acknowledge why we are here. Gun violence has deeply affected countless lives, leaving a lasting impact on individuals, families, and communities across the country and across our world. And just thinking about the United States, gun violence is the leading cause of death among children in the United States. Even for the past generation, Black men have died from gun violence at nearly 10 times the rate of white men. Survivors of gun violence and loved ones of homicide victims, as many of you all know on this call, face devastating physical, financial, and emotional challenges, but often don't get the help that you all need to recover. And we also know that domestic violence and gun violence are also deeply connected as well, impacting millions of women every day. And in fact, 2/3 of women killed by an intimate partner are also killed with a gun as well. So just really want us to, as we are having this conversation today, not only are we gathering to discuss policies and programs, we also need to, take time to remember those who have experienced gun violence and our loved ones who are no longer with us due to gun violence. So before we start this conversation, please join me in a brief moment of silence to honor all victims of gun violence and those impacted by gun violence. Thank you. So many of you who may not know, June is marked annually as National Gun Violence Awareness Month. So thank you to all of the survivors, advocates, and organizations that are hosting or even participating in Gun Violence Awareness Month activities throughout the month. As a survivor myself, I understand that pain, that grief, the physical and the psychological effects of dealing with such a traumatic experience as far as being a victim of gun violence or having a loved one who's been affected by gun violence. And, that's what really drove me to this work after my experience of being a victim of gun violence. I found out that the teenager who had shot me was also a victim of gun violence 4 years before he shot me. And just like me, that teenager at the age of 14 years old was released from that same hospital back into that same community with no help, no victim services, no victim compensation, no housing relocation support, no help at all. And I strongly believe like his unaddressed trauma played a key role in my shooting years later. So while I know, and many of you know the effects of gun violence. What I also know is that I also know the strength, the resilience, and also the courage that often emerge in the face of gun violence. And our work at Crime Survivors for Safety and Justice is really driven by the stories of all survivors, and also is driven by the need to create safe communities, and also by this belief that we can come together, that we can heal together, and also that we can prevent crime from even happening in the first place. So our work at Crime Survivor Safety and Justice, our work started 12 years ago. Since then, our membership have grown from only 12 members. Now we have over 200,000 members across the country and growing. I know after this call, I'm going to see that membership grow, to build this community up. So our membership have grown over the years. We've also have trained hundreds of survivors to be organizers, to be storytellers, to be advocates. I think about survivors like Miss Kat Perkins in Los Angeles. I think about people like Jill Henderson in Austin, or Miss Yolanda in Philadelphia. I think about mothers like Bertha Purnell in Chicago, Miss Sheila, who's organizing a watch party right now in Cincinnati, Ohio. And also think about other survivors like Felita Smith, who also survived a horrific shooting as well. And those survivors, and many of you on this call, have turned your pain into your passion, your pain into power. So we've trained a lot of survivors across the country. We've also been able to help about 150 grassroots organizations, many of them who did not know about any funding or wasn't made aware of this funding, whether it's at the local, state, or at the federal level. We've helped about 150 grassroots organizations secure public funding through our direct capacity building and also technical assistance. We also have been trying to really build this infrastructure of victim services in communities, and we've been able to establish 52 trauma recovery centers and growing, to really provide that much needed crisis assistance and support as well. And a key part of our work as survivors is building community, but also building power to change laws. We've been able to pass over 100 legislative campaigns, including changing victim compensation programs in about 12 states through our direct advocacy of our members and our legislative partners as well. And through these efforts of victim compensation reform, we've been able to open up the opportunity for over 500 survivors to be newly eligible for victim compensation funds as well. I want to shout out a survivor, Quintel in Lansing, Michigan. Quintel is a survivor of gun violence. Quintel, was applied for the victim compensation program in Michigan. He was denied twice access to the victim compensation program, but thanks to the advocacy of him and other survivors in Michigan, we've changed that law in the state of Michigan. After that law became into effect, Quintel reapplied for victim compensation, was finally awarded that much needed assistance through the victim compensation program as well. And also we've been able to move about $3 billion in public funding to more community safety programs that focus on trauma recovery, mental health, and victim services as well. And all of that work would not have been possible without our members and our partner organizations across the country. So we've made a lot of progress, and you all will hear from some amazing panelists. Our partners in this work talk about the progress that's been made in local communities across the country and states, also at the federal level as well. So while we've made progress, there's still a lot more work to do. Many families and communities are impacted by all forms of violence, and we need to prevent crime from happening in the first place. And it's going to take organizing, it's going to take advocacy, it's going to take policy changes to make that happen as well. So I'm honored to be part of this conversation, to be joined by such an amazing panel of experts and survivors. You all, their voices and their expertise is always continue to be inspiring. So I encourage each of you to listen, to engage with us in the chat box, and also begin to make a plan to take action as well, because change begins with dedicated and passionate individuals like yourselves on this cause. So I'm honored to welcome our panelists for today. So if our panelists can join us as part of this conversation, we have three amazing leaders. We have Aqeela Sherrills. Aqeela is the founder and the executive director of the Community-Based Public Safety Collective. We also have Amber Goodwin, who is the founder of Community Justice. And we also are joined by Greg Jackson, who is the deputy director of the new White House Office of Gun Violence Prevention as well. So thank you so much, Aqeela, Amber, and Greg, for joining us for today's event. So let's dive into it. I know our survivors organizations are waiting to hear from such amazing individuals. Aqeela, I want to start with you. Aqeela, 2 decades ago, you were a community advocate that played an important role in the peace treaty between the Bloods and Crips in Watts, right in Los Angeles. But months later, your life changed forever by gun violence. Can you take 2 or 3 minutes to share how you've been impacted by gun violence and what led you to continue to do this work?
Sure. Thanks. Thank you so much, Aswad. And big ups to the CSSJ community. So excited to be here, with this distinguished panel, my brother Greg and Amber. Um, you know, um, you know, I grew up in a war zone, as Aswad said, like many of you. I was born and raised in the Jordantown housing projects. And in 1992 was instrumental in organizing the peace treaty that changed the quality of life in our neighborhood. Um, and some 16 years later, after organizing the peace treaty, taking it to many cities across the country, my oldest son, Sherrill, who was, one of the real reasons that I became a lifelong advocate for peace, graduated from high school in 2003 and was accepted to Humboldt State University, came home from winter break, went to a party in an affluent neighborhood on the west side of LA with some friends and was shot to death at the party. Nothing ever prepares you for the loss of your child. Even though I'm no novice to violence, I've witnessed it all my life. But one of the things that I learned from that experience is that peace is not a destination; it's a process, right? And that public safety is not just the absence of violence or crime. It's the presence of well-being in the infrastructure to support victims and survivors in their healing journey. And so for 3 decades or for 20 years since the murder of Terrell, I've doubled my effort and committed myself to ensure that that in Terrell's memory and for the thousands of people who have lost their lives unjustly, to make sure that their deaths are not in vain. And so as one of the co-founders of Crime Survivors for Safety and Justice, proudest work that I've done in my entire life, is turning this pain into power and utilizing our collective voices to be able to move resources to support more safety organizations on the ground. As Aswad said, I'm the executive director of the Community-Based Public Safety Collective. And, we are a national technical assistance agency that provides training and advocacy and support for community violence intervention organizations as a complementary strategy to policing in cities across the country. Our belief is that you can't have public safety without the public. And it's a direct complement to the works that you do as survivors in this work, because there's still, high impacts of violence in urban communities, folks who are growing up in poor, low-income communities of color are 15 times more likely to be hurt by violence and 3 times less likely to get help, right? There's a real need, for trauma recovery centers and victims advocates and community violence intervention workers who are credible messengers. I like to say that it's Pookie, Raheem, and Sabrina, who are trained in conflict resolution, mediation, and de-escalation strategies that leverage their relationship capital to create safety in neighborhoods, and so so much of what I do today in partnership with some of my colleagues on this call is about making sure that that survivors have a voice in policy conversations, because survivors have to be at the center of anything that has to do with public safety, and that that we want to make sure that as we continue to grow the field, that we all play a significant role in being able to make sure that that resources is flowing into this work and supporting folks in their healing journey. In addition, that we're creating a whole new workforce, honestly, of folks, of community health workers and victims advocates and violence interrupters, incredible messengers, to be a new constituency in this movement around redefining public safety.
Awesome. Thank you, Aqeela. And we're going to come back to, because I have more questions, want to learn more about your organization that's doing amazing work across the country. And Aqeela, thank you for sharing your story and also being a co-founder of Crime Survivors for Safety and Justice. I know when you helped to found this organization 12 years ago, I don't think you would have imagined, right, that we will be 200,000 strong and across the country. So thank you for helping all of us, many of us as CSJ members, get to this place in healing, being able to have a community organization to be a part of. I want to turn it over to you, Greg. So Greg, today you are the Deputy Director of the White House Office of Gun Violence Prevention. It's good to have you in that also office, but also Greg, like me, right? You are also a victim of gun violence. You've been shot before. Can you talk a little bit about what that experience was like for you as being a victim of gun violence, and what support services would you like have been available when you went through that experience? Great, we can't hear you. So we're gonna come back to Greg so we can get his audio set up. So Amber, I want to come to you, and then we'll come back to Greg. So Amber, you've spent 20 years, right, working in advocacy, grassroots, and also electoral campaigns. You're also a former assistant district attorney as well. Can you share what led you to work on issues related to gun violence?
Yeah, I want to just thank you all for having me tonight. I just am seeing everyone in the chat, being in a room full of those people that I really respect, but also have been in the trenches for such a long time. I also have to shout out the Texas people who are on here, Trisha, my girl, and also I don't know if Dill's on here, but so many other people who are doing incredible work. And I also want to just start off by thanking you for the work that you're doing. I think that so many times, especially with survivors and people who are working on the front lines of whatever advocacy issue, many people don't thank you for your work because many times it's not out in public. You're not getting the fanfare. I don't think anybody came here because you wanted to be famous. And so there's so much work that you all do and really having to probably carry around a lot of trauma from the work. And so I just want to thank you. So I actually am currently still an assistant district attorney and also working, founded the Community Justice Action Fund, had the incredible honor to get to work with all of you and getting to work very close with Aqeela and also with Greg. And so just honored to be here tonight. And so, yeah, I got involved about 10 years ago, working specifically on gun violence. I had worked in advocacy campaigns, worked for President Obama, worked where I've actually met Greg, and worked on a ton of different campaigns and was a union organizer for a long time. And really, when the Sandy Hook shooting happened, I thought a little bit about working on gun violence, but I'd worked on different social justice issues. And the issue of gun violence, even growing up in Texas, was something that I thought about, but I didn't know that there was actually a career that I could actually work in gun violence. And so about 10 years ago, I started working for a partner organization of all of ours for Gifford's organization. But what really stuck out to me as I was traveling around the country and getting to see and meet so many people like all of you here, many of you that I've known for a very long time, was that there was this real need for, and what I was hearing from people was this need for a space, whether it's a political home, a policy home, but a home for specifically for Black and brown folks, for people who are underrepresented, if that's people different socioeconomic class, but there needed to be a home for that for policy. And I had spent my entire life working in policy and advocacy. And so community justice was born. And so we have been around this week is our 8-year anniversary, and we have been laser focused on gun violence prevention policies that would really impact communities of color in particular. And the reason for that is because there was what we'd seen across the country was that there was really this policy response anytime that there was a mass shooting that happened in predominantly white communities. But when something happened in a low income community, there was a homicide that happened, we weren't getting solutions. We were getting why did this person get shot? Why did this person do this? Whenever it was all survivors, it was people that you all know and love. And so we wanted to flip that on its head and make sure that we were actually not only getting funding, but also getting policies, comprehensive policies that could really change the conversation on gun violence. And so we've gotten to work with so many of you. We work on all levels of government. We not only work directly with elected officials, we hold those elected officials accountable too, which is also part of our job too, to make sure that they are not only asking you all as survivors. I'm sure if we were in a room, I would say, everyone raise your hand if you have been asked to speak at something only as a survivor and not to actually talk about solutions. And you all should be leading the solutions. You all are the solution. And so making sure that survivors, people who are directly impacted, folks who work on CVI practitioners, I've learned so much about this from folks like Aqeela who have been on the front lines for a long time. And so we do, and we work on policies, and we work on gun violence, again, very specifically on gun violence and the harm that gun violence has done in our communities. But looking at the whole of the gun violence reduction kind of strategy, comprehensive reductions, and that includes, working in places like Austin, Texas, and Travis County, and getting the very first trauma recovery center in the state of Texas. And so, things like that, then, if we had just been focusing on one part of the issue, then we would have not been working with Tara and her incredible team to get that done in Texas. And so just been really excited to see all the different partnerships and see all the different roles that you all have played. And so part of my also role is, as we continue to move forward, it took me a very long time to be a lawyer. Those who know me, it took me almost like 20 years to become a lawyer. And so I'm also an attorney and I'm working as an assistant district attorney. And so also get to work on comprehensive strategies, legal strategies as well in the gun violence prevention movement. So just really excited and happy to be here.
Awesome. Thank you so much, Amber. We'll come back to you because I want to learn more and hear more about community justice and some of the initiatives that you all are working on as well. Greg, are you able to hear us, Greg?
Yeah, I can hear you. Can you hear me?
Yes, we can hear you. Awesome. So thank you so
Awesome.
much, Greg. So Greg, yes, I want to come back to you once again. You're the deputy director in the White House, and we want to hear more about your work. But before you got into that work, you've been an organizer. You've worked on campaigns, but unfortunately, like so many of us, especially Black men, you became a victim of gun violence. Can you share a little bit more about how that experience was like for you, and what support and service you wish would have been made available to you?
Yeah. I mean, that's, prior to this, I was someone who was always passionate about politics and had been involved in the political space for quite a few years. That's how I met Amber earlier in my organizing days. We both was out there fighting to get Obama elected and reelected, and we're successful twice. So we're very proud of that. But after that role, I joined a group called Organizing for America, and was helping build out longer term ways to fight for some of the priorities of then President Obama, and served as a Southern Regional Director, oversee the Southern states and how we're fighting for different policy changes. But literally during the training, I had some family friends in town, and we went out to dinner and out for drinks and went to like a little lounge. We were having a great time, great evening. But as we were walking home, there was like a fight outside of the place we were leaving, and the two guys were arguing. And when they saw us coming, we were literally just walking past them to get to our car. But when they saw us coming, one pulled out a gun and started shooting and shot me. And he didn't know me, but I still don't quite know if he meant to shoot me or not. But the bullet that hit me hit two arteries. And I remember just hiding, like half a block away from where he was, and just sitting there waiting for him to come around that corner and finish me off. But he never did, luckily. And then I, fought my way through the next few minutes, and luckily my cousin tied a tourniquet to slow the bleeding, and I was taken to the hospital, and there I discovered that the bullet that hit me hit two arteries, and that I was dying from blood loss, and that's why I was in and out of consciousness. And I'll never forget the most frustrating thing was when I arrived at the hospital, I was, met with investigators and interrogators and not my doctors and surgeons. And I had to go through 3 rounds of interrogation from law enforcement about what I was doing that night and where I was and where was my gun and why was I there and what was the fight about. And they just didn't believe that I could have just been walking by and been a bystander, because I fit the description of so many folks that I guess they stereotyped as shooters or involved in violent lifestyles. And even regardless of what I look like, what I was clear is that the priority was to solve the crime, not to save my life. And luckily, I worked through those discussions fast enough to get to my surgeon, Dr. Jimmy Street, who actually just emailed me today for the first time in 11 years, which is pretty cool. And he shared that I only had about 26 minutes left to live due to blood loss. And he had to rush me through surgery. And so luckily I got through that surgery, got through 6 other surgeries in that time. A lot of my political Obama family supported me. Folks like Amber had my back, but it was a tough road. Just 6 months of just kind of being stuck at home with my parents and off the grid. And in those 6 months, I started just seeking solutions and answers and just trying to figure out how can we prevent this from happening to others, and how can I use, my own experiences and relationships to help further things. And so that's where a lot of my crash course with the trauma of violence, the pain, the ripples, but also the policy was in those 6 months. I was reading and digesting and learning as much as humanly possible. And so just came out of that hospital bed, or out of my bed from my parents' house after 6 months, just fired up to do something about this issue. And I started locally, helping with violence prevention strategies in DC, with the mayor's office, worked on one more campaign and was really frustrated because I saw how politicians weren't taking it seriously on Capitol Hill. And so I decided to leave that world, and luckily was hired by Amber Goodwin with community justice and started my work fighting for policy change on Capitol Hill. And I usually, I feel like cursing, but I don't know how many people you got here. So we kicked a lot of butt in Capitol Hill, and we got them going. And thankfully, we passed the first bill in 30 years. We moved billions of dollars through the American Rescue Plan to our communities. And a lot of the momentum that we're now, we're now saving lives from was born out of some of those initial battles. Amber participated in the first hearing on urban gun violence in American history on 2019. And I think it's embarrassing that that first hearing didn't happen until 2019, but you can see a very clear change in how America has treated this issue right after that point, where Reggie Moore and Eddie Bocanegra all fought for alternative solutions and resource-driven solutions to address violence that centered victims and centered communities, and not just law enforcement strategies. And so there's been a huge revolution, if you will, in how we've attacked this problem. And the last thing I'll say that I'm so excited about it is that it's working. Last year we saw the steepest decline in homicides in American history, with 13% declines. And the big difference is not policing strategies. It's not any type of music cultural change. The big difference is that we've invested in community-based strategies at historic levels, and we're pouring into people in a way that we never have in the past, and it's starting to work. So I'm excited to be a part of that momentum, and really to be a part of that in this new job in this office, which I can share more about in a little bit.
Awesome. No, thank you, Greg. Thank you for sharing your story as you were sharing that. For me, just had that moment of reliving what I was going through after I became a victim, and it was the same experiences, right? Of questioning, feeling like you contributed to your own victimization in some way, not getting a lot of help from the justice system, and wanted to make a difference, right? Wanted to make a difference. And for me, it was getting involved in organizing, it was getting involved in advocacy, and also was connecting with other survivors and other organizations who were on the ground in communities. So Greg, thank you for sharing your story. At CSJ, as we said, we're like healing through action. You are the definition of that. And now, you're in the White House, right? You're not have a seat at the table, you actually have an office, right? in a position, in a position that's historical for this country. Greg, would love for you to talk a little bit more about that. I know you all have been extremely busy these past few months, as Greg show us his office in the White House. Y'all see the charts. You see Rob over there hard at work. Greg, can you talk a little bit about some of the initiatives that you all are taking on at the White House Office of Gun Violence Prevention, or some of the key priorities that you all are working on as an office? What's some of the work that you all have been doing these past few months?
Yeah, well, I'll try to compress it, but man, a lot has happened. We have had historic progress made, but I'll just share some big top lines. The American Rescue Plan was probably the first big thing where this administration invested over $15 billion into public safety efforts, of which $2 billion have gone directly to community violence intervention programs. The president's first series of executive actions focused on CVI funding, reentry programs, and at-risk youth, and so opened up some historic resources for each of those three kind of communities and strategies. In the summer of 2022, we actually passed the first bill to address gun violence in 29 years, the Bipartisan Safer Communities Act, which is huge. Right now, we're doing like a 15-day social media highlight of all the different pieces of it. But in that bill, it included the largest investment in youth mental health, $1.3 billion to go to schools to help schools improve their safety efforts, $250 million for community violence intervention. It funded 14,000 more youth mental health professionals. It allowed us to close the gun show loophole and the online sales loophole. It greater defined what it means to be a dating partner to help us prevent violence against dating partners by guns. It also pushed us to, or actually it made gun trafficking a federal offense, and we've actually prosecuted 501 individuals who have been trafficking firearms. And that's a big deal because before this administration, if you were trafficking guns, you got away with it with a written warning, like a parking ticket. You know what I'm saying? And we found one person who trafficked 103,000 guns and got away with warnings. So now that is a federal offense, and 501 have been prosecuted, 64 have already been charged. And so we are going after the source. We've also forced unlicensed private sellers to become now licensed. So that's over 20,000 sellers of guns now have to be licensed, now have to conduct background checks. So that's huge. And all of that live within that bill. Beyond that bill, we've also done some pretty innovative things. With the Department of Labor, we created a series of grants that are focused on job opportunities and economic opportunities that are focused on communities most impacted by violence. So 4 new grants of funding that is based on jobs and poverty, but prioritizes communities most impacted. We funded a new program to train school-based mental health professionals, and we made sure there was a piece of it that prioritized HBCUs so that we can ensure that we have culturally competent mental health professionals going into schools that are high risk and high need. We also launched the first ever federal safe storage campaign, and we've already had 2 major school systems adopt it. New York City last week and Las Vegas, Nevada, about a few months ago. But they are actually now educating parents and teachers, and they're sending letters and resources home on the importance of safely storing your firearms and the risks of not doing so. That never happened before. But we also know that 76% of school shootings, the gun came from the home. So those are just a couple of the big new things that we've started to push forward. I actually want to share 2 more quick things. We worked with CMS and CHIP, and CHIP program focuses on health insurance for children, right? Children that are in financial need. And in that program, there's what's called the Health Service Initiative, which means funding that can go towards any health effort to help youth. Well, we talked with them and we were able to get them to roll out guidance that these dollars can be used for youth violence prevention programs, recognizing that the #1 cause of health-related issues and death is gun violence. So now $15 billion of CHIP funds can now be leveraged to help with youth violence efforts, whether it's CVI, victim services, whether it's just mentorship programs or safe storage campaigns, we unlocked that source of funding, and we're pushing states to start thinking about everything that they're doing that's youth-related and health-related, that gun violence should be at the top of the list of how they're using those resources and dollars. The last big thing I'll just share, two more quick things, is we also are engaging states and cities. So we launched the Safer States campaign, which essentially is just a way for us to organize and put pressure on states to pass legislation that we know can address violence. And we did that in partnership with state-led organizations and state-focused organizations, but also national organizations like Community Justice, like Giffords, like Everytown, that have these state-level campaigns, and made sure that the priorities of the activists in our communities are being prioritized at the state and local level. And I know with ASJ, one of the major things that you all push was trauma recovery centers. That's one of our big priority policies we've been pushing states to implement, to fund, and to put in place across the country. And 31 states now have responded to that agenda and passed legislation. And the last thing I'll just share is that we're looking at how do we improve victim services, especially for those who are impacted by mass shootings and high concentrations of violence, especially in places where the media doesn't cover it. And so we created the first ever FEMA-style response team that can help communities that have been impacted. And right now, our team is in Akron, Ohio, where 27 youth were shot at a birthday party. And this is in a Black community. This was in a Black neighborhood. You probably didn't see it on CNN. It's not dominating the news. And that's not our call to make. But what we do know is that 27 people shot in Akron, Ohio is just as important as youth shot in Parkland or Sandy Hook or Newtown or any other of these high profile media focused moments. And the trauma is similar, if not the same or worse. And so our team now can deploy resources based on the severity of the problem, not based on the number of media hits and interviews. And we think that's a new way to make sure that everyone is impacted and victimized, that we're just getting closer to a more equitable approach to help communities, regardless of their financial status, their background, or how engaged they are with local media. So those are just a few highlights. Again, there's more you can learn. I would encourage you to follow us on our social media because we'll continue to highlight our progress. And I also encourage you to watch the president's speech on Tuesday. I mean, it was really a report on what we've been doing and how it's working. I mean, he went through every single section of some of these life-saving strategies and really highlighted in depth how it's working and how it's continuing to work. So excited to be a part of that.
Awesome. Thank you so much, Greg. So just a lot of tremendous work, right, happening at the local, state, and also at the federal level. Greg, you talked about, billions of dollars, invested into communities through the American Rescue Plan and also the Bipartisan Safer Communities Act. It was really about investing in those safety solutions that actually work, right? Mental health programs, victim services, more programs for youth, community violence intervention, actually helping people get back to work as well. Those are the things that help stop the cycle of violence as well. So thank you for your leadership and looking forward to seeing just the incredible work the administration continues to do as it relates to this issue. Amber, you're celebrating the 8-year anniversary of community justice, right? We'd love to hear a little bit more about this amazing organization that you all have found. Can you tell you a little bit more about some of the work that you all do at the local and at the state and at the federal level, some of the initiatives that you all have?
Yeah, thank you. And I just want to, again, shout out the incredible work that obviously Aqeela is doing, and we'll hear more about it. And then Greg is, they're both my brothers. I've known Greg for a very long time, and I know that it is a very tough job. You're the guy for it. And so we have your back, Greg. But it is, it's just been incredible to us to see all the work that you guys are doing and building partnerships too while you're doing it. And keeping survivors, because I'm sure you'll talk about this more about this too, but keeping survivors at the forefront and really making sure that we feel that the White House is our house too. So we do work on policy work. We build policy. So we work with incredible organizations like you all that have like really the boots on the ground of the organizers and running organizing campaigns. We build policy, and so we write legislation from start to finish. We work with policymakers. So we have an incredible network of over now, I believe, 200 policymakers. So policymakers, city council people, district attorneys, members of Congress from all over the country, all Black and brown, all people of color who have committed to public health approaches to gun violence in all, I believe, all 50 states that we have represented at this point. And so it's an incredible group of policymakers, whether they're elected or appointed, who are fighting for gun violence on all levels of government. And so we work with them and we build policy. So we write policy, we get it all the way through the legislative process. So we work specifically on writing legislation. Something that's new that's coming out that we just announced a couple of months ago is that in September, we will have our first model policy exchange. And so if anyone here has ever gone to like the National Council of State Legislators Conference or ever been thinking, okay, there's this incredible bill in Texas or in California, and I wish we had it here, and then didn't want to like start from scratch and actually just wanted to already have in place what you wanted to do and maybe just tweak it a little bit for where you are locally. We're building a model and have built a model policy exchange that is just a database of copy and paste bills that have actually passed, specifically on gun violence, public health approaches to gun violence, to community-based violence, community violence intervention. And so instead of saying, okay, I want an Office of Violence Prevention in Texas, you can say, okay, how did California do this, many years ago, and how did they keep funding it? What did they do this last year that made it even more impressive? And what did they do in Maryland? And can I talk to the governor there? And like, how do they talk about this? And so it's going to have actual physical policies that you can take. It's going to have like the fiscal notes to it, how much the bills actually cost. It costs taxpayers, and then just best practices. And so we're really excited about that. So we build the policy, and then we help with implementation. And we do a lot of that work, all of this work, but specifically the implementation work. We work hand in hand with frontline practitioners to make sure that we're not just people who are sitting in offices somewhere or working with policymakers who are trying to implement policies that we're not directly on the ground working on every single day. And so we work a lot on making sure that the policies are actually led by the people who are doing the work, especially whenever it comes to CVI. And so lots of policy making. So we are working in 14 states right now. We're working at the federal level, and in the federal level, so the federal level as in Congress, but then also nationally, we are also working and building campaigns. And so for the last few years, we've worked specifically on Invest in Us, which is a national strategy on reducing gun violence, but specifically around community violence intervention. And so those are the funding streams. So the ARPA dollars, helping to get the Office of Violence Prevention, all of that was a part of our work and collective work with the Invest in Us coalition and that campaign. But we also have other campaigns. One of the reasons, and I didn't mention this before, that I'm involved in and will always stay a part of these movements is because as a Black woman, I see the impact of gun violence and how it impacts our communities, the disproportionate impact of especially so many of these intersectional issues whenever it comes to gun violence, whether it's domestic violence or interpersonal violence, whether it's the rise of suicides in communities of color and especially in Black communities. But really looking at some of the intersectional work. So we're doing a lot of work now on domestic violence intersection, even between community violence intervention and domestic violence and interpersonal violence, really taking a lot of the strategies and policies that have been successful in CVI and working with domestic violence survivors to see whether or not we can do some of that work on the ground locally. And so build policy campaigns, advocate for policy campaigns on all levels of government, and then we pass legislation as well. And then again, as I said, we hold elected officials accountable, and we do that through a variety of ways. Sometimes those are legislative campaigns, sometimes those are public awareness campaigns that we work on, but we do those again on all levels of government. And the last two things that I would just say is we have built a policy agenda, and we revise it every couple of years, knowing that there will always be new policies. It's a living and breathing document, but we fundamentally believe that the public health approach is the right one for gun violence, and that just locking people up is never going to be the answer. And so we know that we need the resources. We need to be looking at the root causes. And so earlier this year, we released one of our newest policy agendas that takes this comprehensive look. And so what we've been doing and will continue to do this year is implement policies. And in the policy agenda that we put together, it has a ton of policies. We're tracking policies across the country and helping people build policy campaigns. And so just really quickly, we have 7 different pillars. So looking at violence intervention, so specific policies that people can pass and take legislation on things like CVI, things that have been working in other communities, risk factor reduction, looking at addressing the root causes of gun violence, youth violence prevention. We know I know people don't like when I say this. As someone who's in their mid 40s, I know I am no spring chicken. And so we know that there's a lot of really young people who are doing incredible work that also should be in leadership, but also are directly impacted by gun violence every single day. And so specific strategies and policies around youth, intimate partner violence, and then some other strategies around making sure that we are doing accurate. And Greg talked a lot about this, and I know it's a lot of what Aqeela does as well, and that all of you do, but making sure that there's accuracy as now that we're actually able to look at and get funding for things like research and data. It's been just this huge priority of ours to make sure that we're actually passing legislation, whether it's through funding or other opportunities, to make sure that we are actually continuing to get that data, that it's accurate. And so 5 years from now, when people are saying, well, did CVI work? Did these trauma recovery centers actually help people? Where did the funding go? That we can actually say and have some efficacy behind our work, because we know we are scrutinized more than other folks. And so we're really passionate about making sure that research and data is a part of our work as well. And so, building the comprehensive policy campaigns is really our bread and butter, but we are expanding into building capacity in that and really looking at a lot of the intersectional issues that impact our communities.
Thank you so much, Amber. For the dedication, as someone just said in the chat box, and just the importance of the legislative work, right? The importance of organizing in legislative work is the insider strategy and it's the outsider strategy, right? So thank you so much for just uplifting a lot of the campaigns that you all have, and just the importance of changing policy, the importance of writing legislation that not only helps survivors, also prevent crime as well. So to learn more about community justice, we're going to put the website in the chat box. And once again, one of our partners in this work, it takes the partnership, takes collaboration of our organizations, right, to work together at the local, state, and at the federal level to really enact the change that we need to see as well. So Aqeela, I know you're always extremely busy, right? As we mentioned, co-founder of Crime Survivors for Safety and Justice, but also, you did a lot of work in Newark, New Jersey, and now you're a survivor, you're an advocate and also a national leader in this movement, and been doing it for decades, and you're now leading the collective. Can you tell us more about the work at the community-based public safety collective, and also the work that you are doing with community violence intervention organizations across the country as well?
Thank you, Aswad. Yeah, so I would say that, some of our really formative work happened in Newark, New Jersey. In 2014, I was invited by Mayor Baraka to come and build out his complementary strategy to his existing public safety infrastructure. So we launched the Newark Community Street Team and built out a three-pronged strategy: high-risk intervention, assertive outreach, and victims advocacy to address, Newark's high violence situation. Newark was on the top 10 most violent city list for almost 50 consecutive years, family. And, today we've had 7 consecutive years in a row. When we started our work in Newark in 2014, the city had 104 homicides. Last year, we recorded 47. And so community violence intervention works, it's about hiring resident, neighborhood credible messengers, training them in conflict resolution and mediation strategies, and deploying them in their neighborhoods to leverage their relationship capital to mediate conflicts to peaceful resolve. And then you wrap victims advocacy and trauma recovery and hospital-based violence intervention and, new workforce development approaches to this work around, these systems. And you're able to reduce violence and sustain that reduction. In 2021, I was fortunate to head up the White House Community Violence Intervention Collaborative, which the White House utilized its pulpit to organize 14 funders from across the country to fund this community violence intervention initiative to build the capacity of national training and technical assistance organizations like CJ, like Community Justice, like the National Institute of Criminal Justice Reform, like Hobby, like Cities United. The collective was one of those organizations. We worked with 16 jurisdictions across the country, about 53 community violence intervention organizations on the ground, with the focus to build the capacity of these agencies so that they can properly serve as a complementary strategy to policing in cities. It was wildly successful. We had an opportunity to then utilize our advocacy voices to ensure that the Safer Communities Act passed. And of the $750 million that was allocated in Safer Communities, about $250 million was allocated specifically for community violence intervention and prevention strategies. The collective, along with Cities United and Hobby, partnered up and applied to be the lead TTA, training and technical assistance provider for DOJ and BJA to provide technical assistance and training through those grants. Each grant is about $2 million. They actually the second cohort of grantees just passed, like literally last week. So it's a 3-year grant, $2 million over 3 years. So there's community-based organizations, there are law enforcement agencies, there are cities, Office of Violence Prevention, there's state offices of violence prevention that have all been awarded these dollars. And so currently we're working with about 79 agencies across 22 states, helping them to implement their community violence intervention strategies. And there's even more sub-grantees that are connected to these respective grants. And this is, unprecedented. This is the first time in the history of this country that a sitting president, President Biden, Vice President Harris, like this administration has been doing phenomenal things for Black and brown and poor communities across the country. I had the fortune of sitting in the Rose Garden and hearing the president say that law enforcement is not the only solution to safety. I mean, me and Mayor Baraka was sitting next to each other. We just looked at each other and was like, did we ever think that we would hear this in our lifetime? Right. And so, hundreds of millions of dollars are now being invested in this work to stand up organizations and to strengthen the capacity of agencies. And, we have the fortune of being one of the first Black-led community violence the TTA providers for the federal government in this field. It's new. And so we're fortunate that we get an opportunity to work hand in hand with individuals like Director Carlton Moore, who heads up BJA. These are real people, family. The Attorney General, Amy Solomon, we have brothers like Eddie Bocaneda, who is one of the original interrupters out of Chicago that started Ready, who is also embedded in the White House now, in the Department of Justice as a senior advisor. I'm like, this is an administration that doesn't just, they're not just implementing policy, they believe in this work. And this is one of the huge opportunities that I think that we have before us. So we're as Aswad said, man, we're on planes every 3 days, touching multiple cities, helping organizations to build capacity. I want to lift up a couple of programs. Organizations. Agile and the Baton Rouge Community Street Team in Baton Rouge, Louisiana, doing a phenomenal work. Shout out our sister Sateria, Tate, who is the leader of that work in the city. Their first kind of 3 years in launching their street team, they experienced, like double-digit reductions in 2 of the most highest violence zip codes in the city, and they do, mentoring, case management, victims advocacy, safe passage around schools, many of the work that you all do. And one of the things that we've been helping them to do is build, capacity as an agency. Now, coming out of the White House Community Violence Intervention Collaborative, we were fortunate that philanthropic organizations like the Barmer Group, Schusterman Foundation, invested about $22 million in helping us to launch a new initiative called CAPS. CAPS stands for the Coalition to Advance Public Safety. We are a coalition of 4 national TTA providers who are with the goal working in 12 cities over the next 5 years with the goal of reducing near-term violence by 20% in the first year, 15% in the second, and 10% in the third. Some of the cities that we're currently working in now, Baton Rouge, Newark, Indianapolis, and Baltimore. And in April, we just launched a new cohort of cities, Atlanta, Los Angeles, Oakland, and Milwaukee. And some of the caveats that come out of this work is that not only are we helping to assess organizations and develop comprehensive TTA plans for the agencies to help them to grow, we also invest in their work. So through Schusterman, we're moving about $500,000 per city over a 3-year process, to really help grow these organizations' capacity so that they can grow their infrastructure and become like sustainable agencies to be able to receive more of these dollars. The Biden administration has proposed a $5.2 billion investment in community-based solutions and community violence intervention as a strategy. And one of the things that we have to do, family, is that we have to make sure that we have sound organizational infrastructure, both because community violence intervention and in many of our community safety programs, you have to have the business, of your work, and then you have to have the direct service provision in line as well. And a lot of our organizations are still struggling to build the capacity of the business of this work. And so our challenge is absorbing this investment. And so we want to make sure that folks have the infrastructure to be able to absorb this investment, right? We have some of the best training institutes in the country. I think I see my brother, Dr. Aqeela Bashir here from the BUILD organization, the Professional Community Intervention Training Institute, which is a core partner of the Community-Based Public Safety Collective. We're locked hand in hand. In most cities where you see the collective doing work, you can almost guarantee that the commander and the Professional Community Intervention Institute is doing training on the ground. And there are many other trainings and stuff, that are also happening in other cities. Another initiative that I want to share with you all about, and I'm dropping these in the chat as well, is the collective's like longtime partnership and relationship with the Alliance for Safety and Justice. We've recently launched just this new initiative called Scaling Safety. Been around for a long time in name. We've done kind of some great reports. And now we're getting ready to launch in multiple cities across the country. We're currently doing some real work on the ground in terms of kind of data support and infrastructure support with organizations in Newark. And we're planning to roll out in about 5 cities over the next year. And so stay tuned, for that great work. All of these pieces like work hand in hand. And so Aswad, I'll just say this last thing that, Amber talked about, the important work that CJ Action Fund does around policy, and ASJ does around policy. I mean, critical work, right? Once we make the policy is the rule that actually creates the guidelines on how dollars will actually be allocated to communities, right? Then we got to monitor the process to make sure that it goes out into an RFP and then it's put out. And then the work of like kind of the collective and some of our other partners, is to make sure that the community-based organizations have the infrastructure and the capacity to be able to apply for these grants and to then be able to implement them. Because it's one thing to apply for a federal grant, and it's a whole nother thing to be able to manage that grant and, submit the FFRs and the PMTs and y'all know this stuff, you know what I'm saying? It's heavy to be able to maintain contracts and stuff in terms of doing this work. And so, family, that we are an ecosystem, that works together in order to be able to sustain this work in the field. So, we're in conversation with each other all the time. So myself, Aswad, Amber, we always look into leadership to our brother Greg Jackson now that, he's in the White House, making sure that we are, up to date on policy information, as well as like kind of when we need to roll out our advocacy on to make sure that we are, letting folks know, what pieces to be able to stand up for and what pieces to be able to apply for, fam. So, just super excited to be a part of this coalition with all of you so that we can continue to build this work. And as I consistently hear, across the movement that this is not a moment, family, this is a movement, And so this is our civil rights movement of our time. And so we want to make sure that people know that you're a part of making history now. And so stay engaged.
Thank you, Aqeela. And it take leaders, like the 3 of you, and also take the leaders who's on this call, right? I see so many survivors in organizations, right? That started, saw a gap that existed in out of their experiences in that community and started their own organizations. I want to shout out all the grassroots organizations, all the organizations that started your own organization to help meet the need in your community. And as Aqeela, you talked about the importance of training and technical assistance, right? And really building the capacity of organizations to go after that funding as well, which is critical to what we do at Crime Survivors for Safety and Justice. When I started this work, I've been with this organization 9 years. Now, when I started, it was in 2015, right? 2015, when the VOCA cap had increased from about $757 million to about $2.3 billion, right? So, it quadrupled in funding across the country. So my role in our organization the first 2 years was traveling the country, meeting with survivors, meeting with organizations about this huge opportunity and resources to help build the capacity. And I would say 90% of the grassroots organizations that we met with did not know about VOCA funding before. So we use that as an opportunity to educate organizations. We use it as an opportunity to provide training and technical assistance, grant writing support. And through that process, about 95% of the organizations that we've connected with, that we work with, that applied for a grant, received funded, and many of them are continue to receive that type of funding as well. So building the capacity and providing that training and technical assistance is critical to the work that you all are doing in your organizations. Is also critical to what we do at Crime Survivors for Safety and Justice and at ASJ as well. So we have about 20 minutes left for this conversation. Hope you all panelists are reading the chat. A lot of love, a lot of valuable information that you all are providers. I want to talk a little bit about some policies and priorities, but then also we won't have time for Q&A as well. So this question is open to all panelists. So obviously there's been a lot of great work that's been done, a lot of historic investments into to this to help communities impacted by gun violence, but more needs to be done, right? So I'll open up to any of you to answer this question. So based on your expertise, in your organization's work, what policies and programs, are needed to better support people in communities that are most harmed by gun violence?
I can jump in here if you guys can hear me. And unfortunately, I do have to go a little bit earlier, so I have to jump after this. But, there are some very big areas that we still need resources and support in, and all of which was laid out in the president's budget this year. I encourage people to look at it. The one big thing is that we need more funding for victim services. The VOCA fund is exhausted every year, and unfortunately, we shouldn't turn people away from resources and support because government hasn't invested enough in their recovery. And so that's why the president proposed an additional $7.3 billion to go into the Crime Victims Fund to help fund VOCA and ensure that we can use it not only for reimbursement for families and individuals who have been harmed, but also so we can grant more of those dollars to victim service organizations, the CVI groups that are working with families, knowing that one of the best ways we can stop violence is helping people heal through their trauma. And as you said, Aswad, the shooter who shot you had that untreated trauma, and frankly, probably could have done so much more with more resources and support. So we have to lean into that. The other big thing is that, we're focused on getting illegal guns off of our streets, and we're doing incredible work upstream. I mean, we've shut down 423 gun stores. We've shut down 2 gun manufacturers who could not keep up with the regulations. We prosecuted over 500 traffickers. All of that upstream accountability that protects our youth from getting guns in their hands, that keeps guns out of the hands of those who are prohibited, that is all being led by the ATF. And while the ATF is the federal law enforcement division, they are focused on that upstream accountability, and they are understaffed and under-resourced. And so we need more dollars to help make sure that that infrastructure, that level of accountability that's protecting vulnerable folks, has the resources they need. The other thing is that we need to keep fighting for CVI funding. We've seen that where the communities where it's scaled, it's working and we're saving lives, but we are nowhere near the scale that we need to really eradicate this entire crisis. So increasing in CVI funding is huge. And the last thing I'll just say is now that this administration is really leaning into emergency recovery work, providing therapeutic care for communities, providing emergency loans for businesses, providing emergency resources for schools to reopen. All of those emergency responses cost dollars. And when you think about what America has done with fires in this country, for example, think about how many sprinklers are in houses and schools and in the building that you are in right now. Think about how many fire trucks are funded, how many fire stations are funded, and look at the death toll, right? It's significantly lower than what we're seeing with gun violence, but we don't have, beyond police, we don't have this recovery infrastructure that we need. And in too many communities, ambulances are not coming as fast as they could. And in too many communities, businesses, schools, and the entire community is left to pick up the pieces. And so we do need to make more significant funding and providing more infrastructure and more resources to help entire communities recover, just like we've done with fires, just like we do with all these other major emergencies that are disrupting and harming so many people. So anyway, I wanted to just elevate those things. I know that there's way more, but those are just some huge priorities on our end at the federal level. And again, thank you so much for having me. Apologies, I got to jump a little bit early to support some folks in Akron, but just thankful to be here and to be a part of this effort. So thank you.
Yeah, no, thank you, Greg, and thank you so much for the work that you're doing. Thank you for this leadership, man. It's great to have a survivor. It's great to have an organizer and advocate in the office. So you have a lot of support for many folks across the country. So sending you love, sending you strength. Appreciate you for hopping on today. Aqeela, Amber, would love to hear from you all. What a lot of work's been done, right? What policies and programs are needed to better support people in communities most harmed by gun violence?
Yeah, I mean, this is what I wake up in the morning thinking about and go to bed thinking about. I'm sure Aqeela and I both are like, there's 3,000 of them that we could think of. I'll stick to a couple of them that I already mentioned. One is specifically, and I see one of my colleagues, Holly, on here. I think that there's a lot of policy gaps, especially as we're on the precipice of hearing even from the Supreme Court on the Rahimi decision, on the intersection of domestic violence and firearms, and figuring out what we can take, what best practices, but still public health approaches we can take to think about domestic violence also as a public health issue, and thinking about how we can be survivor driven and focused, but also think about things like restorative justice as we think through, like, how do we make sure that we are holding people accountable, but also at the same time living in the reality of kind of the work that needs to happen to move ourselves forward as a people. And so I think that there's a lot of policies that we're thinking about. There's VAWA that has been around for a very long time at the federal government level that has impacted survivors, but there also are policies, again, similar to funding, but also infrastructure that can be embedded in, and it is being embedded in some places like North Carolina and other places where they're actually doing these kind of very survivor, but also other survivor-led gun violence prevention initiatives on domestic violence. And so I think there's a big gap there. And then also in providing specific legal services for both survivors and also for folks who are working on the front lines, frontline practitioners, others. And so I'm actually going to drop it in a chat. Our organization has been working with a group of pro bono attorneys to help support doing some know your rights trainings, and then also to help get as many pro bono lawyers as possible that would be available to help people like CVI practitioners, to help people like survivors, not be their attorney necessarily, and maybe that could be the case, but also just broaden the knowledge that many of us may have, especially those of us who are attorneys, but also just see we have so many attorneys that are across the country that want to be helpful and support the work that we're doing. And I've spoken about this with Lenore, and so really excited that we're going to be helping to stand up some work that'll be specifically legal strategies to help support this in the entire kind of body of work, but also there's this big question that I think happens every time that there's a big political campaign that's happening, which is happening right now, which is like, what's happening in democracy, what's happening in the Zygot. And part of the answer to a lot of the questions that we have is really thinking about, is there a legal strategy to what may happen, say, if there is a Supreme Court decision, or if for some reason somebody decides to take all the money away from a CVI program somewhere, is there a legal strategy around there? Or should we be getting a team of lawyers that's available for that? And I know that a lot of that is much of the work, trauma recovery centers and so many other people are already working with victims. And so we want to put them, any attorneys that we know that are helping, that want to help fill that gap, to put them into help support the work that's already happening. And so don't want to recreate the wheel, just want to get them to work. And so that those are two of the big things. And then also, again, we keep seeing these declines in things like homicides, which has been incredible. We're still looking through the data to really make sure that we have an accurate understanding of what's happening, but we want to make sure that we're also looking at things like suicides and some of the other kind of work, the other work that needs to be done around the mental health and the trauma that may come from even witnessing violence, and the secondary trauma and the tertiary trauma that happens from violence in our communities. And so we're looking a lot at what are the policies, whether it's thinking differently about extreme risk protection orders that are a tool for sometimes law enforcement, but thinking differently about that for our communities, because that is a suicide prevention tool. And so rethinking it to think, okay, for Black and brown people, for young people, for people in our communities, what's another suicide prevention tool to get guns out of the hands that people may be thinking about using them, because that is a rising issue, especially with firearms being the weapon of choice for our communities. And so there's a whole myriad of other ones, and I'll drop in the chat our policy agenda. But again, it's really been predicated off of like so much work that you all have done, and that so many of you. Aqeela Bashir is the first person that I ever learned about community violence before, and I was sitting in LA and learned from him many years ago. And so shout out to him for all the incredible work that he's been doing and what all of us have learned from him. And so, really thinking through, and he was actually part of our policy council, but it was led by people like that to really help us think through like what are some of the policies that are actually working, and then where are some of these gaps. So just thrilled to keep thinking through this with all of you guys as we work together.
Most definitely. Thank you, Amber. Aqeela?
Yeah, it's just about 2 or 3 pieces and stuff. I think both Greg and Amber like laid it out, in terms of policy pieces, right? I think a couple of things. Research and evaluation. We need more investment in research and evaluation, and the right research and evaluation, right? There are tools out there, evidence-based tools. There's RCTs, all these different types of evaluation tools that have been like kind of lifted up to look at the impact and effectiveness of community-based, work that don't always like really recognize us as practitioners. We're looked at as subjects in many of those particular things. And also evaluation is extremely expensive. Some people think that, that process or qualitative evaluation is not rigor. And we beg to disagree. Quality, process evaluations is rigor, and it doesn't have to be in the Harvard Journal or the Stanford, review, to have impact, in our respective communities, right? We need more ways of being able to look at our work through the lens of the people who are actually being impacted by violence in community, right? And so we need more dollars for research and evaluation, more dollars for participatory research, that really kind of like supports and lifts up our work. And I'm glad that that the commander is on here, Aqeela Bashir, because we need more dollars for training practitioners in the field, right? Aqeela Bashir is probably one of the preeminent, trainers of community violence intervention practitioners on the ground, right? We got our brother Marcus McCall, want to give out a big shout out to Marcus, UPI, there's a couple of, like institutes, right? We got the academy now in Chicago with our brother, Dr. Chico. We need more dollars, from philanthropy and from the federal government to be able to support this work, because as this field emerges, we need more dollars to be invested, on the ground. Of course, we need more dollars invested in community violence intervention as a strategy. We need more intervention and prevention dollars. We need money to fail with, family. Failure is a prerequisite for success. We're last year, the federal government invested about $307 billion. That's with a B, 300 billion in traditional public safety, like kind of infrastructure. And when we look at like kind of the impact of that, right? There's a CJ report that came out not too long ago that talked about how when you look at clearance rates around homicides and non-fatals in many cities, they're in the single digits, And so people don't trust in many cases, like kind of traditional, like kind of public safety infrastructure. And this is why it's so important that we invest deeply into, community-based solutions as a complement, not as an alternative, right? Because we need cops, family, out here, and I know that, some people will beg to differ, but I'm like, hey, all of them ain't bad, right? And so, my grandmama's going to call the police, and I'm like, and she has the right to do that. So until we build up, our capacity where my grandmother can reach out to Pookie, Raheem, or Sabrina and call them, and trust that they're going to respond to them and be able to provide, that comprehensive services and, and close that thing out. We want to make sure that that there is investment on all sides. And so in the last piece is pay equity, fam. Community violence intervention is extremely hard work. People, as well as victims advocates, extremely hard work, in terms of leveraging relationships, in community to prevent violence. And so we want to make sure that our crisis responders, that our victims advocates, that our community violence intervention workers, that our credible messengers are being paid well. Especially in big cities like Los Angeles and New York and Chicago. We're looking at salaries in the $60,000 ranges, which is minimum wage in some of these cities. We need to get this thing above the 80s. And so those are the pieces that I would share.
Man, y'all got me so fired up. I know y'all got everybody fired up, right? The importance of this work. For many of us, it's not work, right? This is our calling. So it's going to take, obviously policy changes, right? It's going to take, the training and technical assistance of helping, survivors get access to services and resources to help them heal. But it's also going to take organizing, or it's going to take organizing to really build the political power that's needed on the ground in state capitals across the country. We're almost at time, so just want to thank our panelists. I know many of you are like me, are feeling encouraged, right? Are feeling inspired and motivated to take action. Before we close out, once again, thank you so much to Greg. Thank you so much, Amber. Thank you, Aqeela. Before we close, I want to turn it back over to Jonathan to close us out. Also talk about our call to actions. Also a huge announcement as part of our work at CSSJ. And I want y'all to remember these 3 words: right to heal. Turn it over to you, Jonathan.
Thanks, Aswad, and thank you all to this phenomenal panel and sharing such rich information with us. And I know we're close to time, and we want to just share a few action items that we want people to take action in, and show a clip too for you all. So don't forget to visit all the websites of these organizations, starting with Crime Survivors for Safety and Justice, Community Justice Action Fund, Community-Based Public Safety Collective, and the White House Office of Gun Violence Prevention. Check out their websites, go to their social media pages or channels, and make sure you click follow them or look for more information that was shared today. Also, this month, we encourage you during National Gun Violence Awareness Month to honor someone affected by gun violence by completing the link that we're going to share to light a candle for them. When you complete the link, we'll light a candle for them, and we'll be posting it in remembrance on our remembrance wall on social media later this month. So I think the link is, let me drop the link if we haven't for you all. You can light a candle for a loved one, and we'll share it. And if you haven't already, join our community of survivors by signing up to become a member of CSSJ. I'm going to drop that link. There's another action that you all can take from us on this evening. So looking forward to you all becoming a member if you aren't a member already. And I think, Christina already sent it in the chat, so make sure you become a member. In addition to that, before we close tonight's event, we're excited to share that we are hosting the first ever Crime Survivors Speak March on Washington in DC for 2 days of healing and advocacy in our nation's capital with thousands of survivors from across the country. So I want to show you a short clip of our video highlighting what's to come. For generations, crime survivors have been absent from the conversation about public safety.
For generations, crime survivors have been re-traumatized by a justice system that is supposed to keep us safe.
For generations, crime survivors' stories have been exploited to push agendas that stand against everything we stand for.
It's time to break these cycles of crime and violence.
It's time to take the narrative back.
And it's time for crime survivors all over the country to unite under a new movement that's sweeping the nation.
We are Crime Survivors for Safety and Justice. and we are the future of public safety.
What do we want? Healing! When do we want it?
In 2013, 100 survivors gathered for the first ever Survivor Speak Advocacy Day to share their story and to advocate for change in their communities.
In the 10 years that have passed, 18,000 survivors from 15 states have attended Survivor Speak Advocacy Days at their state capitals,
resulting in 100 bills passed, $3 billion in funding secured, and catapulting their own healing journeys.
This September, following the footsteps of historic marches before us, the new Crime Survivors movement is heading to Washington, D.C. to advocate for change at a national level.
We will march alongside state and national leaders as the largest and most diverse group of crime survivors to ever march for change in the nation's capital.
We are crime survivors.
And we know better than anyone what victims need.
We know that healing, prevention, and rehabilitation are the cornerstones to an effective justice system.
We know firsthand how to take our pain and turn it into power. We are from big cities and small towns.
We are storytellers,
Advocates,
organizers,
change makers,
and healers.
We are
survivors. And when we speak, change happens. Join us for the Survivor Speak March on Washington, September 23rd through 24th in Washington, D.C.
Thanks. Thank you, everyone. And again, thank you to our panelists for joining the conversation today. Thank you all for participating. And thank you to our chapters who hosted watch parties. And special shout out to our CSSJ staff and our chapter coordinators from across the country. Please be safe and take care of yourself. We will be sharing out the webinar recording and the call to action links in here. But before you go, I'm sorry, for those who want to join us in DC, you can stay informed and contact us here in the links. Sorry about that. And Christina just shared it. But thank you all. Have a wonderful night, and we look forward for the recap video and recording.
Thank you all. Have a good evening.